Hello, health heads. Welcome to this dose of the healthcare uprising.
I'm your host, Heather Pierce. I've been working in different facets of the healthcare industry for over 20 years.
And I'm your producer, Jeremy Carr, and I have no experience in the healthcare industry at all. Your resident man on the street, as it were.
Yeah, so we're here to inform and educate on all the latest innovations in the healthcare realm, and equally educating and creating awareness around the most basic aspects of the healthcare system. Things like how to use your benefits, what's a PPO versus an HMO, why Medicare matters, things like that.
Yep, that's pretty much what healthcare uprising is all about. So why don't we tell them what's on the agenda for today, Heather?
So today is our second part and concluding episode to last week's episode with Latham Thomas and Mama Glow. If you haven't listened to the first episode yet, make sure you go back and take a look at that and a listen, and then come back and listen to this one.
There you go. And we'll be back at the end with our overall wrap up for all two parts here, the whole conversation. So without further ado, here's our concluding portion of our conversation with Latham Thomas from Mama Glow.
One of the things that you mentioned when you were talking about the certification for doulas around Medicaid, I really want to talk about that a little bit. And I worked in the Medicaid space for a long time.
Oh, cool.
And so Medicaid has a very special place in my heart. So that's an interesting part there that you mentioned. There's a test that they have to take in order to be reimbursed through Medicaid. And I don't necessarily want to talk about that part, but kind of Medicaid in general. And you had kind of talked about this way in the beginning of our conversation today about serving Medicaid populations. A lot of what you do with Mama Glow and just doulas is so much about equity in the maternal health universe. And I feel like we even touched on when we first met, I had talked about bringing doulas to Navajo Nation, where, here in Arizona, which is huge. And we talk about, healthcare and equity and in that space. So can we talk about what does that look like? And doulas and supporting low income and Medicaid and all that.
I mean, it's always happened. So before there was Medicaid reimbursement even on the table, there were always people offering pro bono services or sliding scale services to people who were in need or finding ways to ensure people got coverage. So this is just having an institutional backing to support work that's already happening. I would say that the Medicaid reimbursement rates in most states are too low. They do not cover cost of living or there's no cost of living adjustment for, seeing where we are today and inflation. People just aren't making enough money. And to do this work full time, people have to take obviously private pay clients. And if they want to also do Medicaid, then they have to be able to not only take care of those clients, but also do the billing. And the billing process is kind of challenging. And so if you're not a person who is kind of on your computer all day or really good at filling out paperwork or really organized, it could take you forever to get reimbursed. Now, I will say the billing system is efficient in that when you submit properly, you get paid pretty efficiently and without question. But it's getting the proper paperwork in the right way. And then it could be one little tiny thing, like a space, or a character difference could make it that you can't get, your claim. So I think that, making doulas also have to learn claims and add an extra layer of administration onto work they're already doing is not a realistic expectation. And it's also super burdensome because now they're being asked to step into this role to provide additional care to people who are already high needs, right? Then they're and also on top of that, provide some social work support. Because these people do not have access to the social service safety net. So make sure they also know what, if there's WIC, and make sure they know about SNAP, and make sure they have access to their local, chapter of X, Y, or Z service. And, if they experience intimate partner violence, make sure they're connected with, a social worker. Like, you're doing all these things to ensure they have the right, sort of, I call it birth village, right? Intact, right? And at the same time, you're not being reimbursed for those extra hours that are kind of non-billable, unfortunately, because of it's just you doing, the care work that is really like patient coordinating, right? And so I feel like we just have to accommodate and account for the burden that doulas face and other healthcare providers face this too. Community healthcare workers face this, obviously nurses, they just have a high caseload and they have to process more paperwork than they get to see patients. And when you get to that, kind of, like circumstance where you have more work than you have people, it doesn't end up being something that people can sustain. And so then you see people leave the workforce, you see burnout.
And that's a problem, whether you're a doula or not. I mean, just providers in general are struggling to keep their doors open because of the administrative burden, the complexities, like plan to plan to plan. They each do it different. It's kind of, I've worked in the side of the business, and so I understand if it's hard for them and they have actual staff that are trained, and then you for a doula who's probably has some sort of special talent and gift to be a doula in the first place, and it's not doing paperwork, right?
Like, don't
And
we have
filing
AI
claims.
now? Shouldn't AI be doing all the paperwork now?
Can we just
Like, isn't that the right application for that?
thank
That
you.
to me
That's what
is
I'm
what
like.
we should.
AI is not cleaning up oil spills, and like, why are we making them
Yeah.
do what we do? Get them off of what
Right.
we don't need them doing what we wouldn't need to do
Well,
what we don't want to do.
It's like,
and the
like
system
filling out
itself,
paperwork
yeah.
is what AI exists to do. Like, it's what it's for.
I think
Literally
there's
what it's
things coming, but
Like,
this goes back to the whole thing. The system is not, the system is just not built for us, right? At the end of the day, I hate to say that, but I mean it is what it is. Either if you look at it from a maternal health perspective, an equity perspective, if you look at it from a provider billing perspective, I mean it's chaos. It's like the health system has been like kind of I think about it as like you kind of like chunk things together and it just starts kind of building on it's like a really bad built home, that you just keep putting additions onto, and then eventually things just start breaking. you know
Yeah,
that's maybe that's
exactly.
my metaphor of the year here for the healthcare system that
that's
I've
pretty
worked
good.
in. Was
That's
that
pretty
good?
good.
Yeah, so it's like,
It is.
yeah. It
It's
feels
true.
that way. And so why would a doula want to sign up for that? That's not what they don't want to fill out paperwork. They want to help people deliver babies.
Exactly. And that's why you have a lot of people who have enrolled, but who may not have processed claims yet, right? And
Mm-hmm.
so they want to like, oh, I'm excited about this, but then they're like, oh, this is what it takes,
Ew,
So I think
maybe
just
not.
lessening that burden, making it easier to understand,
Yeah.
simplifying. Yeah, accessibility is so important, right? And like you have people again, like we have folks who provide services through one of our programs with the city of New York, and they don't have computers, And so sometimes it's like they have to fill out a lot of the forms through their phone, or, everybody has a cell phone, right? So why don't you like make it so that they can like log into I mean, now they have, because we were like, hey, how come this isn't like easy for somebody when they're leaving their birth to just pop it into their phone, enter into a secure environment to like input this information. Oh, well, the computer, like, yeah, but not everybody has that, or an iPad. And also they have to put this information, into a system that's actually on a government server. Like you should have easier ways to do it, right? So
Isn't
the
isn't there an
idea,
app for that?
I'm saying, right? Like, so yeah,
See
so all
AI.
this stuff has to just catch up, right? Like, but it's
Yeah,
always people who are in the private sector finding solutions, right?
right.
Way quicker than like, the government. But I do think that there is headway, like there is a commitment. And I think there's a lot of people who are doing the work to, you know, bring their voice, right? And bring the weight of like the work that they do to bear. And that helps us to advance things. It helps us to I feel like keep the conversation going, but also to make a difference in terms of like how the maternal health landscape does shape up over time.
Do you think that well, and maybe there's some hard data on this, but has the I don't know, the growth of doulas has it gone up over time? Are you seeing that it's becoming more, I don't know, mainstream, more kind of accepted, and so more doulas are out there for people,
Yeah.
especially with like the program you mentioned, and I had heard about it where as like an employer benefit to offer
Yeah.
it to their employees as like, hey,
Yeah.
we're going to pay for this doula
Okay.
service should you want to use it, which I think is so cool. That's such a great way to get it in
Yeah.
like at volume, right?
Mhm. So there's employer benefit, and then there's um, benefits for clients. So if it's within healthcare, it'll be like, interfacing and then intrafacing. Um, I think that we're seeing it, definitely seeing it more. I mean, just like say from our own experience of, working with like CVS Health and designing a nurse care manager doula competency training with them. They wanted to know, like, how do we have the same skills, right, the doulas have, and fold that into the work we're doing with high needs patients? Like they wanted that. Like the
That is
nurses
so
in a
cool.
survey were like, we want this training. So we developed a course, which is like it's a condensed version of what lay people learn. Obviously geared towards nurses, so it's structured differently. And there was quizzes, there were tests, there were workbooks, and it was certified for CEU credits. And so they also got continuing ed credits for taking the course with us. And so and then we also developed a shared decision making tool that the nurses could use with their clients and a website, right? And so all of this, co-branded and in a really great way to bridge this gap, right, of knowledge, and also to the way that we approach it is like you already know a lot of these things. It's really about like what additional veneer of support and skills can we add on to what you already know, and how can you bring this work to life inside the settings you're in, and how can we ensure that doulas are integrated. And so a lot of what we do outside of just teaching doulas, obviously matching doulas with families, and supporting healthcare systems in those capacities and their capacities for building up their teams of doulas as well, is program development. So like CVS is a great example, like developing educational tools and resources for hospital systems that want to figure out how do they language about doulas, and the support that's offered within their healthcare system, or a program that we're just now about to do with one of our larger healthcare systems here, which will be really ensuring that like all of the staffers, not just the nurses, but the doctors also learn this baseline training. And so they'll get like, so we're developing a training for them. We have through the NIH a grant with Northwell Health where all of their nurses get trained in our methodology. So they get doula trained. So it's
That's
amazing.
amazing.
There's a definite excitement. There's
Yeah, there's a
definitely
lot going
excitement
on.
for doulas. A lot more doulas are in the workforce for sure. But what we've been able to do is bridge the gap between providers and help people understand how they could utilize these skills, how it can help impact and inform, but also improve the services they're offering already. And yeah, and then also ensuring that we bridge sort of medical and academia together, right?
Mhm.
Because I think that, these spaces are like over here. Like, I think people don't think about doulas in that context. I think about it as a profession, right? And professionalizing people, educating people, leveraging academia, and as well as research, because we're big on research too. And that's how we've been able to sort of grow this. But yeah, we see it all from this lens, right? Because we're involved in so many projects. So we do know that the landscape has expanded tremendously. And I would definitely say the correlation is with one of the correlations, right, was in 20, I believe it was 17. Linda Villarosa wrote a pivotal piece of reporting for the New York Times, and it looked at Black maternal health. It was the very first time people internationally had understood, but even had it crossed their mind that Black women were dying in childbirth. People thought, like, what? Like, what are you talking about? She broke down how and in what ways, and really was looking at like race and medical bias, and also looking at social determinants of health, and how all of these pieces intersect to create disparity, right? And so it was very interesting because at that moment, another piece came from ProPublica. And so you know how like one, you know, big news outlet will share a piece and then somebody is like right away and it's like a snowball.
Mm-hmm.
It was like that.
Oh,
And
we'll have
what
to find those
happened
articles.
was, yeah, there you can still find them. But she ended up getting like, you know, 2 books off of that, right? Like I
Oh,
think
wow.
her latest book, Beneath the Skin, I think it's called, like is sort of like it looks at that research from back then too. But I would say that what that did was it galvanized people. And so there was already a pool of people who were doing this work already, right? But in that time, right? So heading into 2020, so 2018, 2019, a surge of individuals wanted to do this work. 2020 for us, when we went to COVID, people were not at work anymore. They were home. It was like, what is this life? But people will think about what it was like back then when folks were like, what am I doing with my life? What am I doing to advance myself, to give back? And so people were looking everywhere for solutions, for community, and things that would make them feel like they had a sense of like, you know, you used a word so beautifully earlier, like this you know, of community, of value, of something to give back, right?
And
And so
connection too, I think is a big part of that, right? And
yeah.
especially when
And
you're feeling very secluded, right? And isolated,
yes.
which
Yes. And they
COVID
would have
definitely did to a
community
lot of us.
organizing. Yes, absolutely. So that's what drove them to, right? And
Hmm.
so we went from having like 22 people in a class to like 150 people in a
Oh my
class.
gosh. That's a
Mm.
huge, huge increase.
Wow.
Yeah, it like changed our business. Everybody was shutting down in COVID. We like
You're like, no,
expanded.
we're growing.
Our
That's
business completely shifted, and it was actually thanks to COVID because I
There
think that
are
the
some silver linings of COVID, and this comes up a lot in the show too, is that there's some really
huge for us.
wonderful, beautiful things that have come out of COVID, as terrible and crappy as it was.
It was
I
a huge
didn't,
financial
if it
year for
wasn't
us.
for COVID, I never would have learned how to produce a podcast. I was a
See?
tour
Yeah.
See?
guide before that.
See? Exactly,
Yeah.
right? Like
Yeah.
certain things wouldn't even be happening. I know. And thank God for podcasts. I think that got everybody through COVID.
Oh my gosh. Yeah. Podcasts are important. Well, I'm so happy to hear like that the doulas, the desire for them, the
Yes.
acceptance of their role in or outside of medical facilities alongside of the providers. Like to me, that's amazing because I think there was a time, and I would say even back like when I had my first son,
Uh-huh.
um, so that's 16, almost 16 years ago, the concept in like doula was not a real common thing. And I was pretty crunchy granola back then, doing Kundalini yoga to prepare myself for childbirth in a very natural way,
Yes.
which
Yes.
unfortunately did not happen. But like doula was not, a word that was thrown around very often. It just feels like it's become so much more part of our conversation and and you've just named a number
Yeah.
of ways. I mean, there's an NIH grant, although I hope that's not affected by anything going on. And
No,
then
we're
you've got
good. We're chewing
plans.
it. It's good.
Yeah. Good,
Somebody's
good, good, good.
advocating. Yeah.
Because maternal health, I mean, it's a big, big, big thing and we can't ignore it. And
Yeah.
it's
I
a yeah.
I have one final question for you.
Yeah.
It sounds like you've been pretty well mainstreamed at this point. Are
Yes.
there, and I'm a baseball fan, I like statistics. Brass tacks, do you have any like hard statistics on the effects that having a doula like does it like that cesarean rate, that surgical birth, like, do you have real numbers on how much it brings that down, how much it affects
Yeah.
the postpartum depression side of
This is
things?
a
And
great way to wrap up this
Yeah,
this
well,
this conversation. I love
yeah,
yeah,
it.
so the presence of a doula results in a 9% drop in use of pain relief, so pharmaceutical pain relief, so 9% drop, a 28% fewer cesarean sections.
Oh,
there it
Um,
is.
that's the
yeah,
one right
The
there.
big number.
Yeah.
28% fewer, right? Which is huge.
Yeah.
Yes, definitely increased maternal satisfaction. We don't have like this exact tactical data on that because also we have like poor reporting, but what we do know is that as people experience the support of having a doula, that if they have baby blues or postpartum depression, that it resolves faster as a result of having that doula present, increased breastfeeding success. And so people, with a doula, uh, not not only establishing breastfeeding at the time of birth and leaving the hospital, but continued breastfeeding over the course of months. We see, like fewer cesarean rates. I'm trying to think of anything else that is big.
I mean, those alone, the
Yeah,
almost 10% drop in pain meds and an almost 30% drop in
yeah,
surgery.
yeah.
That's those
The
two stats
shorter
alone
labor,
are
like
impressive.
I would think so, right? And then the length of the labor is like 30 minutes, they would say, in terms of like shorter. But I think it really depends, like everyone is really different. And what I hope people also think about, like, because yeah, if you are a person who's like, I need the data, we have it, and there's so many there's so much amazing research also that's coming out of a lot of these programs that are happening at the local and state level where people are capturing data about populations to understand what the birth outcomes are looking like. And so what we are seeing is similar rates when we're looking at these smaller swaths of individuals. So a couple of thousand people, over time, like over the course of a year. And so I would say that my hope and prayer would be that that everyone understands there's access, there's an opportunity to work with a doula regardless of your financial status. One thing that I always want people to also think about, and this is going to be a little bit of a left field thing, but you know how it's like tax season and people get really nervous about finances and nervous about like, money. And I think it's a really kind of fraught period for people. But then when you call your accountant, you know how they're like non-judgmental and they're just like, oh yeah. And you're like, and it's
Yeah.
for some people, it's like such a, emotional process. And they're just like, it's just numbers, right? And so doulas are like this, right? And so you can come, you're like, oh, I'm anxious to, say this is going on, or this thing is happening in my life, or I don't have this money. It's like, okay, but you need the support. So we're going to figure it out. Like, that's the energy. Like, you're meeting people who get that you're human and get that there are actual barriers, right? There's actually structural barriers to support because this country, we've built systems against caregiving. I mean, we really just have. And so, yeah, it makes sense that you don't have the money saved for this or that you don't have a community to lean on to. And so, part of what our job is as members of this community and of this field is to ensure that we can handhold people. And so, if I can't do it, I'm putting you in the hands of somebody who can. And that's really how we work. And so I want people to not feel embarrassed, like, oh, I don't necessarily have the finances. That's cool. There's programs where we literally have programs where we pay for it, through the funding that comes through the foundation, or we have it through a grant. And so it's paid for. Doulas are paid for. You just get to fill out a form. It's brief. And then you get to have the services, right? And so you get to keep your dignity in that process. And so I think that this is what we have to kind of encourage people to do, because a lot of times what happens is folks will desire care and they feel like they don't deserve it or that they can't afford it or it's not accessible to them. And so what I hope comes out of this conversation is that people who know folks who are pregnant, that you can direct them to local resources and know that there are always an option, because like our goal here is to improve maternal health outcomes. And we do this by providing handholding in this way, like we evolved for. And so we want to make sure people have access to that.
And as you were talking too, and I've been thinking about this, one of the big shifts that's been happening in the healthcare industry is that we're moving away from slowly, but we're moving away from the reactive care and more into the preventative care, value-based care. That's a big, I've worked in the value-based care space for a long time, and it didn't dawn on me until like literally a minute ago that a doula is part of preventative care. Because if you think about costs in healthcare, right? And if you're deducting 28% from the amount of C-sections that are way more expensive, right? By all means, way more expensive than a natural, vaginal birth. And
Yes.
not to mention, you even said the postpartum stuff. And if you go down, that postpartum space, now you're going to see doctors and getting prescriptions. So there's all these costs that start kind of racking up. So a doula
Absolutely.
is part of the value-based care like universe, which is what we want to stop bad, expensive things from happening. And so
Yes.
get yourself a doula. You
Yes.
might, you're likely not to have a C-section, at least far less than you would have before. If you are going to have postpartum depression, it won't be as bad. So
Yeah.
it's kind of a beautiful thing when you think about it. And and so, get yourself a doula,
Yourself a do,
ladies.
Dom.
Yeah.
And you know what I love about what you said is that this is what people need to hear, right? Like when they're trying to sell it, like they
Yeah.
need to hear what are the costs? What are we preventing? And also like we should be thinking about the inappropriately high C-section rates we have in this country, because physiologic birth is how we are designed, and we are designed to give birth this way. There's a reason Mother Nature made it this way, and she's deeply invested in us birthing this way. And I want to say that because um how you're born is so important, right? And not just like how you're made to feel, all those things are important too, but what is transferred to us through vaginal delivery is so critically important for our overall health and who we become. The actual microbes that inoculate our system that come from our mother and through that process of being born is critical to our whole well-being, right? And so the actual birthing process for the baby also epigenetically imprints them healthily. It literally imprints onto the epigenome. The epigenome is like essentially this system that sits above your genes, right? And then turns off and on certain genes, depending on certain conditions that show up in your life, right? And what happens in birth is what we call eustress, positive stress, right? And so for the baby, they actually experience stress, but not in the way that we would think about it. We think about birth being stressful because we're like, oh my God, the squeezing, it has to be a lot for them. They have oxytocin. Oxytocin slows down the fetal brain. They're chilling, right? They have no idea that they're being squeezed in that way. They feel it, but they're not like, wait a minute, I'm in a passageway. It's tight. What's happening? They're not freaking out, right? They actually have and have been hardwired to literally move through this process where they're being massaged and squeezed rhythmically by the oxytocin flow that's pulsing, right? And triggering the euphoric hormone of oxytocin, but also DMT, and also melatonin, and all these other neurochemicals, neurohormones help us to have this experience. The baby is being imprinted positively by that experience. They get information that they need that builds resilience in their body from the day that they're born. And so when we take that away out of convenience, or we take that away out of, a misunderstanding of the body, or because we're rushing, because we've designed a system that's built on urgency and efficiency, which is mechanistic, by the way, going back to that, right? When
Yeah.
we focus on urgency and efficiency, like we actually interrupt that actual genetic imprinting that's supposed to take place. And so that's why I like to protect this and think about, like, yes, a baby, C-sections are sacred too, right? Some people have to be born that way.
I was
And
just going to say sacred. Oh, it is like a sacred thing. And then you said it. I'm on the
sections are
same
sacred too.
wavelength here.
They happen. And it's not, and again, it's non-judgmental. If it has to happen, that's where we are. But doing that as a way to just like make things easier and not thinking about what does that mean long term for health? What does it mean long term for healing? What does that look like for someone's, experience with their baby? And sometimes it means separation. What does that mean? So we just have to think about this experience that we're having. We're mammals, right? And like this is a delicate and very like spiritual, as well as uh what's the word I'm looking for? Like
Mhm.
vulnerable process. It has to be protected. We have to stop thinking about it like, okay, put them in the bed. We have to think about it as a transcendent event. If you think about what conditions people set in place for folks who are entering into meditation, if you look at what people are doing for folks who are experiencing some of the healing pathways available to them through psychedelics, there's like they set up a way for you to have that experience, right? Birth requires that. It requires like low lighting. It requires a room that is set up in a way that you feel safe. It requires a people that you choose that are there that make you feel safe. It requires trust, you know? And so I'm also sort of in a position where I want us to rethink the design, and I want people to envision for a future where the space that they're in to deliver, the people that they choose, the birth team, or we call the birth village, that's intact for them, is one that they feel connected to but feel safe with. And I want us to rethink like how we can make this process more elegant and not just satisfactory, but that people feel a deep sense of satisfaction and joy, but also empowerment when they come onto the other side. Because that's really we're supposed to feel that. You're supposed to come on the other side and feel like you can do anything. Like that's the goal, right? And so many women, right, they're coming on the other side and they don't feel themselves, or they don't feel whole. They feel fragmented. That is not what birth is supposed to do. Birth actually does something for us. Yeah.
It's a beautiful thing. It certainly can be.
Yeah. It's
So
meant to be, right?
it's meant to be. Yeah.
Yeah,
Yeah.
we need to get back to that to help people. And when you do have an experience that didn't go as planned, we need to process it, right? Like there's a space that we hold for people to process and mourn the experience they desired, right? Mourn what didn't happen, and like find a way to put that in a container and move forward in their life. There's so many people who come to doula training, y'all, and they're telling me stories of things that happened to them like 25 years ago that
Oh
they
wow.
never told,
Hmm.
right? Or a birth experience. And so it's also a healing place for people, to come do the training, to sort of unearth their own stories and also become a better practitioner in the process. Yeah.
I love that. That's
Hmm.
beautiful.
Thank you.
Um,
Thank you
Did
so
you
much.
want to ask about the DEI stuff?
yeah, I think, as I said, hey, this is a really great way to wrap up this conversation, and we just keep talking, and I love it. And this is,
It's
no,
going to
this,
be a long one.
I
this
know. I
is,
feel like I'm in a coffee shop with y'all, just like, whoop.
Right.
but that's what, that's the vibe we want here, because
Yeah.
we want to make healthcare accessible and less complex, kind of demystifying healthcare and bringing it to the people, because I think
Bringing it to me.
man, we're afraid to talk about these things in a deep sense. We're so superficial about all of it, and that we're trying to do the opposite here. So I welcome this continued conversation. So we've really
Yeah.
touched on so many wonderful things, but I think we do want to talk about, before we do wrap up.
Yeah.
The universe feels really heavy right now, and there's a lot of things going on in the healthcare world and non-healthcare world, but truthfully, everything weighs on us, right? There's just a lot. And, we've talked a little bit today, we've touched a little bit on equity, maternal
Yeah.
health and equity, but, let's kind of wrap up and talk about maybe the role of diversity, equity, and inclusion (DEI)
Yeah.
in maternal health and delivering
Yes.
babies, because delivering babies and bringing humans into the world is like literally maybe the most important thing that we
Yeah.
do. I
Yes.
mean,
Yes.
so
Yeah, I mean, I think that like it's sad that we're in a place where diversity, equity, inclusion, or DEI is like a bad word. I think what people don't understand what it means is that we diversify and create environments where we have a variety of people of backgrounds, perspectives, and experiences, and lived experience and lived expertise. And so when you don't have a presence of women, right? Because first it's women, and then we can go down from by intersection, we can go to race and then other identifiers. But when you don't have this diversity, it really impacts what people's experiences are within the care system. When you don't have people who have maybe a cultural understanding of a patient's experience, right? They could be misdiagnosed. If you have other people there, there's like, oh, I understand this as X, Y, or Z, right? You need diversity of language, right? And background. I feel like just the forcing um of our systems in making them like more homogenous means that people don't get a holistic, view or holistic experience when they enter into the care space. I think an example of this, um, a great example of what it can look like to be done well is, you know, if people are learning and doing continuing education for like CEUs and CMEs, they can take a variety of courses on the health equity track. And those courses could be with other institutions. It also can be with community-based organizations where there's people who are vested in community and who are sometimes working with populations and with peoples and leadership that doesn't look like, the folks that they're teaching. And what it does is it creates space for real learning, for interrogation of our belief systems, and for a change, right? Where we actually become better. And so this idea that like discomfort will come up and like, oh my God, we don't want to deal with that. But no, we need to deal with the fact that there are things that we can change systemically, but we need to do them together. And I think that what we're going to start to see, unfortunately, with all this pressure for people to abandon DEI initiatives, is that you're going to see less talent come forward, like people who we're not going to be going into the schools in the same way and pulling and calling and trying to find those talented individuals that you would never find, right? Um, it'll also push out and ensure that people who, like may already be in position have a harder time, And I just think that, where we are today, we really need that, these experiences of people from all over to shape our medical system and to reshape it. I feel like, I learned so much from young people and I get to work with kids from all over the world. And I look and I'm like, oh, that's the future. Like a person who came from, Cote d'Ivoire, a person who came from, Southeast Asia, a person who comes from Seattle, a person from like this is really good. Like this meshing and enmeshing of cultural difference of background and beliefs and also learnings means that everyone learns from each other too. And so not just what we learn from the institution, but what we learn in community. And so what I hope is that in this process of like the dismantling of a lot of the hard work that was done and a lot of the strides that were made in building towards health equity, looking at medical bias, looking at medical racism within institutions, looking at how we study our populations and even like the ways that we're actually implementing better standards for studying populations, minoritized populations, all of these things, right? There's been so much important work happening. And so I hope that instead of it being abandoned, that under new terminology, people find another way to kind of just continue operating undercover, because the work has to continue to be done, right? But I definitely think that, I think people should know that the biggest beneficiaries of DEI are white women. So like this harms everybody, it's like if you're trying to target one population, you end up harming everyone. And so, and we're going to see the impact of this over generations. And so I think as we talk about it, it feels disheartening, obviously, but I do think that we as people have always been resilient. We've always found solutions. We've always, under pressure, have found ways to use ingenuity to problem solve. And so I feel like regardless of the administration, like regardless of who's in office, we have work to do, and that doesn't stop who's in office. It doesn't stop what we're doing. And I think we have to just, sit with that. Like you guys, like with Healthcare Uprising, it's like, this is why you're here. Like you're here to help beat the drum and continue these conversations and continue disseminating information, because people are literally shutting down our access to credible spaces to get information. You're providing that for the people, right? And so I just feel like, in a way, it's like, yes, it's upsetting and all that, but we can't like get overwhelmed, because we won't be able to continue our work. And we have to use it as fuel, like you all are doing here, to help us continue to like put one foot in front of the other. And so that's how I kind of, step back and try to remember, like, we can only bite off what we can chew. And if we try to like, attack this big behemoth, it feels like it's outside of your control. And so I think a final thing I'll say to this is that, one thing I learned early on about myself, and that I feel like is helpful for some people, is figuring out like what side you're on in terms of where you like to put your energy, right, towards change. And so some people are part of system dismantling, right, breaking things down, metabolizing, like, and then, breaking things down, destroying things, picking them apart for reform, right? And then there's other people who are into building things. And so those people are, with this, these big imaginations, big ideas, and then they execute. And so I think figure out what side you're on. Are you somebody who's going to take your sledgehammer and start, breaking down these bricks of this system, because we need it to fall, right? We need it to change. So are you that person, or are you over here building the future? And if you're a builder, and I consider myself a builder, and I love building
I'm
things.
a builder.
Okay,
Yeah.
we're builders, right?
We're builders.
We're builders. So join us on the side of building,
Yeah.
because we're needed. Because what's going to happen is when this thing crumbles, whatever this is, right? Whatever this system is that's going to change, like we're watching it change, and it's kind of frightening, right? But when this is done, people need a place to go. And that's why they come to us. They come to us who build. And so you need both. You need people. And sometimes you're at a different point in your life, right? Sometimes you're on the other side. But I know that at this point in my life, I'm on the building side. And so come join us with building, y'all, and join us in solution building, and join us in building a future for the future generations, for our children, but also for a future design in healthcare that centers our needs.
Yeah. Yeah. I'm a builder, and I keep thinking to myself, we've come so far, right? We have come so far. We have accomplished so much. You don't just flip a switch and it goes away. It's here. And especially in healthcare. And I love, your comment about our podcast being, part of the builders, right?
I like that part too.
Yeah, like we're that platform. We talk about education and awareness, and you can't have innovation without education. If people don't know what they don't know, well, then they can't move forward. They can't make a decision. They can't choose to build or break apart. And so Yeah, we're here to build, and we're gonna have to add that to our tagline.
There you go.
I love
But
that.
yeah, but what a really just, I don't know, a beautiful way to kind of sum everything up, especially, like I said, when things feel a little bit heavy, but
Yeah,
there's so many good people out there doing such really, really good work, and that doesn't just stop. Like we're gonna keep going.
that's
We're
it.
gonna we're gonna keep doing the thing
Yeah.
because that's what we're here to do.
It,
And
it's like the people in charge
Literally.
are going, stop working together. And we're like, why would we
I
do
know,
that?
right?
yeah,
No, we're
They
not
don't
going to do
want
that.
us to be in joy. They don't want us to work
yeah,
together or find joy, but we have to continue.
yeah. Where
You know,
there's a
this is
will,
all
there's
we
a
know.
way, and
There
That's
you go.
it. This is all we
you
know.
know, all day long.
That's
Well,
why it's called healthcare uprising.
uprising.
Yeah, right
We're
there.
we are uprising for sure.
That's right.
And
It.
thank you for being a part of the uprising. This has been a really amazing conversation. I honestly could have not have anticipated where this where this has gone. We're gonna have to break this into a two-parter, Jeremy.
Yeah, maybe it's
Oh my
long
Um,
gosh,
enough. Maybe.
right?
but
Oh,
this
I
is,
love
yeah,
that.
this is absolutely fantastic. So wonderful words to end on, but of course, we want to give you an opportunity before we say goodbye. Where can we find you online if somebody's interested in Mama Glow or wants to become a doula or wants a
Yes,
doula, right, to help them with their
yes.
pregnancy, and their delivery? Share that with us, would you,
Yes,
please?
absolutely. Thank you so much again for this opportunity. I was so excited to be able to do this with y'all. Just mamaglow.com. It's MAMAGLOW. We're also on Instagram, same handle, Mama Glow. And I'm on Instagram, it's just Glow Maven. And so we have doula trainings. You could find a doula as well, but I think most importantly, if you're looking for a community, right? Like a community of care workers and stuff, we've got an amazing crew of people and just excited for what's to come this year. So thank you so
Yeah.
much for this opportunity to be with y'all here in community today.
This is, yeah, really wonderful. Thank you so much for being with us. And I cannot wait to listen to this
I know,
episode.
right?
I'm really excited.
And there you go, the conclusion of our first two-parter in our conversation with Latham Thomas from Mama Glow. So what's our main takeaways from that big long conversation there, Heather?
Well, we started talking about maternal health, and that was definitely the main focus. But we definitely we definitely traveled into other parts of overall healthcare. But I think most importantly, Martin, maternal health is far-reaching, and one big way to ensure optimal birth outcomes for moms and babies is through the support and advocacy of a doula. Advocacy being, I think, a really important word, and particularly minority groups, underserved communities. We talked a little bit about how they serve Medicaid, that's low income. They're often the ones who have it the hardest and they need the most support. So I think that's definitely a big point to be made. So.
Yeah, that's a very good point to make. Yeah.
Yeah, and also kind of, tied to that, and generally speaking, for a first world country, maternal complications, death, even negative outcomes for, mom and baby are really much higher than they should be. And it's kind of mind blowing.
I've looked at that chart, us compared to all the other, first world nations,
Yeah,
and it's yeah, like we're literally almost off the chart. Our
yeah,
numbers, our maternal death rates are so much higher than everyone else's.
yeah.
It's crazy.
It really shouldn't be that way. And it has been proven with some pretty incredible stats that she shared during our conversation and data. I mean, that you could probably look it up anyway. Is that the involvement of a doula can really, really change those outcomes. Makes what was it, like near
The
30%, I think.
28% reduction in surgical births.
And
Yeah,
yeah, and to
that's a big number.
C-sections. Right. And surgery brings a lot of, potential new complications and issues. So if you can get rid of that, you can lower costs too. We talk about the cost of healthcare, and that kind of one thing leads to another. And so doulas really are a part of preventative care at the end of the day. We talk a lot about value-based care in American healthcare nowadays. It's becoming more, preventative versus reactive care and getting out ahead of big problems before they even happen. And so, in the space of maternal health and, women delivering babies, a doula is a part of that, is a solution to that problem, right? That is preventative care, based
Yeah.
on the statistics that Latham shared with us. So,
Yeah. Yeah. That was one of the definitely most informative and educational conversations from my perspective that we've had on this podcast so far. I learned a lot. I didn't even know what a doula was coming into it. So
now the more you know.
yeah, the more you know.
There it is.
And now I know more. And
Yeah,
knowing is half the battle. How
it
many
is.
old school 80s taglines can I come up with right now?
Keep going. Yeah,
I love it when a plan comes together.
it's awesome. Yeah.
Props to anyone who got that one.
Yeah, we definitely had a great conversation with her, and I think we ended on a really meaningful, timely message as well. So,
Yep. Yep.
yeah.
Very well done. Very well done. Worth the two parts, I think. But
Yep.
yeah, and there you go. So if you like what you hear, hit those happy fun buttons, whatever platform you're on, your likes, subscribes, shares, bell ringings, and we got a Patreon you can check out for join for just $1 a month, as low as $1 a month, and get early access to all our upcoming episodes and support the uprising. Every dollar counts when you're running a podcast, believe me. So we appreciate anyone who's willing to go join up over there. We'll have some members only chat rooms and stuff going on once we populate the place and kind of build our kind of in-house community, as it were, on the Patreon. We're on YouTube. We're on all major listening platforms. Search Healthcare Uprising. Where else should they seek us out there, Heather?
You can find us online at healthcareuprising.com. And of course, all of the social media channels like Instagram, Facebook, LinkedIn, and Blue Sky. And just search Healthcare Uprising podcast and you'll find us.
There you go. Yeah, it's just that easy to join up with the uprising. So, yeah.
That's about
There
it.
you go. Why don't you take us out of here, Heather?
Well, as I always like to close out with, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.
Shut